Hi, I'm Dr. Stephen Goldstein, and I'm talking to you today, another in my series of reducing the confusion in gynecology. And what I want to talk to you about is called dynamic ultrasound. Now, what do I mean by dynamic ultrasound? Unfortunately, in this country, if you go to the gynecologist and you have an exam and they think they're feeling something, they send you for a sonogram. Sonogram is often done by a technician, may take 50, 60 pictures, give an initial report. All too often that just gets signed off on by the doctor, whether he's an OBGYN or a radiologist. They never hold the transducer. They never examine the patient with ultrasound. You know, the American College of OBGYN has listed what they think are 19 indications to do a vaginal sonogram on patients. And the number one indication is pelvic pain. Well, how do you diagnose pelvic pain with a still image? You can't. You need to hold the transducer to see if the transducer elicits that pain. You need to use your other hand on the lower abdomen. It is a dynamic study. And I have written now a cover story for the journal OBG Management. I lecture constantly. Whether you're a radiologist, an OBGYN, an ultrasound technician known as a sonographer, you need to learn to examine the patient with ultrasound. It is not just an ultrasound examination. You're giving up a lot of the information that we can glean from this. And often patients come to me and say, can I get a copy of my study? And I say, your study was what was going on here while I was doing it. I don't employ a technician, sonographer. I do these exams myself. Ultrasound is very operator dependent. It is only as good as the person performing it and the equipment that they utilize. So if you need to have a pelvic sonogram, make sure it's being done in a dynamic fashion. Make sure that the physician, who basically you've contracted with, is examining you with ultrasound, not simply looking at still images. We're sitting at home doing teleradiology, looking at these images in order to generate a report. Thanks.